Hi, welcome to So What About Cholesterol? And we're also going to talk about essential fatty acids since they're really important for your health. My name is Barbara Solomon. I'm a board certified nutrition specialist and a certified functional medicine practitioner. So we need to start with a disclaimer. First of all, I am not a medical doctor. The following is for information only and is not intended to be used to diagnose, treat, cure, or prevent any illness. This should not be considered medical advice and is not a substitute for care by your licensed medical doctor. Okay, let's talk about cholesterol and some facts. First of all, we have to have it. Cholesterol can be made from fatty acids, amino acids, and even glucose, and there's no other chemical in the body that has so many ways for which to make it. If it wasn't important, the body wouldn't be designed to do so. Now, the body makes about 75% of the cholesterol you need, and some of the literature actually shows it's even higher. And it has a feedback loop. So if you're not eating enough cholesterol, the body's going to make it anyway. One of the reasons that we spend 1/3 of our lives in bed is to produce cholesterol and repair cells and perform other essential maintenance. So that's some pretty important stuff. Now, besides cholesterol being a precursor to our hormones, which is really important, it's in every one of our cell membranes. It's the precursor to vitamin D. It's a component of bile salts to help us break down fats. It is important for proper neurological function. It plays roles in memories and all kinds of stuff. So this stuff is really important. We shouldn't really be trying to get rid of it. Now, studies have shown that the root of cardiovascular disease is not elevated cholesterol, but really the damage that comes before you have signs of high cholesterol. Basically, cholesterol is going in there and trying to repair damage. High cholesterol is a response to this injurious agent. And if you look at the Jupiter study, it showed that lowering LDL without reduction in inflammation does not prevent heart attacks or even death. Now, people with low cholesterol get as many plaques in their blood vessels as those with high levels. The Honolulu Heart Studies showed an increase in the risk of death in older patients with low cholesterol levels. And the reason I'm including this in the slide is I really want you to see these words. I really want you to pay attention to these studies. Now, in fact, 50 to 75% of all people who have heart attacks had normal cholesterol. The only group that seems to have a really big risk is those with familial hypocholesteremia, which means they have a really hard time managing their blood fats. So is LDL bad and HDL good? We've heard all about it. Now, it turns out that these are just carrier proteins. We need cholesterol to rebuild and replace our cells. And so we have to put this cholesterol onto something. Think about trying to mix water and oil. It just doesn't work. So what we do is we put these on carrier proteins or buses. So we take this cholesterol and we put it on LDL to get to all the places it has to go. And once it gets done, it takes it and puts it on another carrier protein called HDL that returns it back to the body so you can either recycle it or get rid of what you don't need. LDL in itself, even though it's just a carrier protein, high levels may be dangerous. And the reason I say that is because it's the type of LDL that can affect your health. LDL is designed to be very light and fluffy. So it travels through the bloodstream. Oh, it sees something it needs to put a Band-Aid on and poof, it drops off the cholesterol and it bounces off and goes on its merry way. That is a good thing. But what if it's small and dense? So instead of hitting that artery wall or that place that needs damage repaired, it hits it and it gets stuck. Well, then the body goes, whoa, there's some inflammation there. We better go get some more cholesterol, right? And Band-Aid this thing up. That's what it does. It acts like a Band-Aid. So if you keep having these injuries, it will keep sending cholesterol. And lo and behold, if you look at the picture below, you have a clear artery, and the next thing you know, here's one that has had some damage, some inflammation. The body's trying to repair it, and it's small and dense, and it gets stuck, and it starts to oxidize, and you start to build this thing up with cholesterol, and that's where cardiovascular risk can occur. Why the controversy? Why is everybody saying cholesterol is so bad? It kind of started off in 1940 with the first study called the 6-country study. And there was a researcher named Ancel Keys, and he published this study that showed that heart disease was associated with fat intake. The problem with this data is that it wasn't just 6 countries, it was 22 countries, and that data was hand-picked. And so when you look at all the original data, this link between fat and heart disease is not supported. Here's all of the data of 22 countries. And on the bottom, you can see this is the percent calories from fat. And look here, as fat increases, there's a section right in the middle that's showing, hey, death is not occurring. This axis here, this y-axis, is showing death. And you can see, even at very high levels, 40, 50, it's not that high. So if you handpick the data, it can show, yeah, there could be a correlation, but when you include all the data, it's not supported. So much so that he continued his work in 1955, and he wrote, "It is concluded that in adult men, serum cholesterol is essentially independent of cholesterol intake over the whole range of the natural human diet. It is probable that infants and children and women are similar." So here he is directly saying that it doesn't matter if you're eating cholesterol, it's independent of this. And then in 1997, he published, "There's no connection whatsoever between cholesterol in food and cholesterol in blood." And we've known this all along, or that all along. Cholesterol in the diet doesn't matter at all unless you happen to be a chicken or a rabbit. Why a rabbit? And that's study number 2. Now, I'm not going to pretend I can even pronounce this person's name from 1913, but what he did is he fed rabbits purified cholesterol, basically to get their levels up about 1,000 milligrams per deciliter, which is extremely high. And he found, we're looking at, doctors are talking right now about 200 milligrams a deciliter, right? And he found that when that happened, that they developed vascular lesions and they formed in the arteries of the rabbits. Now, the problem is that rabbits don't eat stuff with cholesterol. They are strict herbivores, and they are normally not exposed to dietary cholesterol. Therefore, they're not designed to digest it or any type of animal fat. Well, no wonder why they started to develop problems. So they ran a parallel test using rats and dogs, things that were designed to be eating animal fats. And they found that they did not produce lesions at all. So that's study number 2. Now, study number 3 is the Framingham Heart Study. It started in the 1940s, and it's under the direction of the National Health Institute. And basically, they're looking at a group of people, and they're trying to see if they're developing cardiovascular risk or stroke or heart attack with high levels of fat. And what they're finding is there's no indication of relationship between dietary cholesterol and serum cholesterol levels. If the intake on animal fat is held constant, there is no relation of cholesterol intake to serum cholesterol levels. Finally, number 4, politics. So I want you to check out this article in The Salt, of which blames politics for the whole cholesterol debacle. So you can tell I'm a pretty big fan and proponent of cholesterol, and I really like these levels, especially as we age, because we have to be repairing and replacing cells, and we need cholesterol to be able to do that. So you can at least tell where my bent is. So if it isn't cholesterol, what are the cardiovascular risk factors? And I wanted to list these out for you as well. Anything that causes inflammation in the body. Again, inflammation is going to cause us to send repair elements like cholesterol to those areas of the body. But the biggest thing that I'm finding, sugar. Sugar undergoes something called glycation, which forms AGEs, and that can lead to inflammation and damage the walls as well. And fructose is even more prone to this. So a poorly controlled diet that doesn't keep blood sugar levels stable can increase insulin resistance, and that will affect the amount of cholesterol produced by the body, and you'll start to see elevations in cholesterol levels. If you have dysfunctions like adrenal or thyroid dysfunction, that'll also cause cholesterol levels to increase. Issues with methylation, metabolic syndrome, consumption of bad fats. Those bad fats replace good fats in the cell membranes, and then we can't process our sugars correctly. But there's good news. The balanced, good diet consisting of whole nutritious foods has been shown to increase particle size and reduce insulin resistance and inflammation. All those things that can contribute to cardiovascular disease. So it's really all about diet. So there are particular supplements you can take to kind of help you with this. And so what would you say if I said there was something that could prevent a heart attack or cut your chance of a second heart attack by up to 50%? And what if it was inexpensive and non-prescription? Well, Dr. Ron Krasanti says that essential fatty acids have been shown to lower triglycerides, turn off arrhythmias, and dramatically drop your chance of dying from a heart attack. In fact, it is among 3 of the top nutrients that have been shown to make a difference in those who survive a heart attack. They include essential fatty acids, the 8-part vitamin E, and magnesium. So that's what I recommend. Now let's get into detail about these essential fatty acids. They do a lot of things. They reduce inflammation throughout the body. They keep the blood from clotting excessively. They improve blood vessel health. They support a healthy and glowing skin. They help with good brain and nervous system function. They keep our cell membranes nice and fluid so things can go in and out and cells can communicate. They lower the amount of lipids circulating in the bloodstream. They improve the body's ability to respond to insulin, and they help prevent aberrant cell growth as well as. So we're going to talk about 2 types of essential fatty acids, omega-3 and omega-6. And they're both polyunsaturated fatty acids that are necessary for human health. Because the body doesn't make these, they can only be obtained by diet or supplementation. And in order to maintain good health, we have to have a correct balanced ratio of omega-3 to omega-6. If we have too much omega-6 in our diet, it may lead us to have more inflammation. You also might have heard of DHA and EPA, and really that's just omega-3s, and they're basically converted by the body into these two substances. So when you think about DHA, you're going to think about brain. The brain is made up primarily of fatty acids or phospholipids, and DHA makes about 60% of our brain. It is vital to its function. It reduces inflammation and it prevents degeneration. And it does this by maintaining good cell membrane health, as well as supporting new cell growth, facilitating the release of neurotransmitters, and aiding in communication. It's important to keep in mind that DHA levels do decrease with age due to oxidative damage. DHA is also found in high quantities in the retina, which is the light-sensitive part of the eye. So if you are having issues with your eyes, you may want to look at your DHA status. Next, when we talk about EPA, we're going to think anti-inflammatory. It is also found in the brain, but not to the degree that DHA is. Now, EPA fights overall inflammation and can be beneficial against inflammatory-based disorders like cardiovascular disease, diabetes, cancer, autoimmunity, Alzheimer's, and so on and so forth. So what are some of the symptoms of low essential fatty acids? Maybe you have poor brain function or painful joints or chronic pain inflammation throughout the body. Maybe you have a dry or unhealthy skin or issues with dandruff. How about hormonal imbalance or excess earwax, depression, fatigue throughout the body, tension headaches, muscle fatigue? These are just some of the things that might mean that you have low essential fatty acid status. So what's causing these low essential fatty acid levels? One of the big things is the consumption of hydrogenated and partially hydrogenated fats, as well as fried foods, because what they do is they replace the good fats in these cell membranes with these very rigid fats. And if the cell membranes become stiff and rigid, they can't communicate. Things can't flow in and out as easily as they should. They also block the insulin receptors so that you can have problems with sugar regulation. And next thing you know, you're having problems with insulin resistance, or your triglycerides are becoming elevated, your cholesterol is starting to increase. It's really important to maintain good cellular health, and we do that with essential fatty acids. Now, people that have problems breaking down their fats due to a bad gut system, or they have problems with their gallbladder, or maybe their thyroid's not working so well, or they can't release their enzymes, may also have problems with fats, and they may not be able to get a good amount of essential fatty acids in the body. Now, how much do we need? The typical American diet contains 25 times the amount of omega-6 to omega-3, and that's not so healthy. Our ancestors consumed a ratio of 1:1 from omega-3 to omega-6. And we want to maintain anywhere from 1:1 to 1:4. The thing is, omega-6 at high levels can be inflammatory. Therefore, if we have 25 times the amount, we may be setting ourselves up for degenerative diseases. What's the best source then? If we can only get this stuff from food or we get it from supplements, what should we be eating? Wild-caught Alaskan salmon and more wild-caught Alaskan salmon. Also, Alaskan black cod, fantastic, great source of essential fatty acids. Now, you can also find some of this in vegetarian sources like walnuts and flax seeds, beans, dark green leafy vegetables, but they have to be converted into a form the body can use, and a lot of people have problems with this conversion process. With omega-6s, we're going to look at eating good nuts and seeds. And we're going to, they're found in vegetable oils and snack foods, but we want to stay away from those because those fats have been damaged in production, and they're not our best choice of dietary fats. There's other supplements you can take. You could do, if you have problems with familial hypercholesterolemia, you might want to take red yeast rice concurrently with CoQ10, because the red yeast rice is a natural statin, and that will block the use of CoQ10, so you want to make sure that you continue to take that. There's GLA, essential fatty acids, a good type of omega-6. Evening primrose, black currant, and borage oil are good sources of that. And then there's the things that will help break down fats, such as choline and bile salts and digestive enzymes. So those are things that you might consider for supplementation. There's many folks that are on statin drugs. About 1 in 4 adults is taking that. Again, they block some of the enzymes used to make cholesterol, but they also block the use of CoQ10 and other things as well, so be careful. They have been shown to help reduce inflammation, which is fantastic for reducing cardiovascular risk, but unfortunately they don't do anything to affect the particle size. Now, there's other things that they do affect. They have been shown to cause cellular and muscle damage and lead to muscle cramping, exercise intolerance, sexual dysfunction, liver and nerve damage, and other detrimental effects in about 10 to 15% of the folks that take them. So just to be aware that they don't come without side effects. Next, I'd like to talk about blood testing for cardiovascular risk because we do expect cholesterol levels to increase as we age. We need to repair and replace cells, but these blood lipids should be evaluated with other markers. We need to understand what is the cause. Is it due to problems with blood sugar regulation? Is it due to inflammation? Is it due to infection? Is it due to thyroid issues? So instead of just looking at a blood lipid panel by itself, we need to maybe look at the other markers such as homocysteine for inflammation, C-reactive protein for inflammation, fibrinogen, hemoglobin A1C. And because there's issues with hemoglobin A1C, fasting insulin to look for some markers of blood sugar dysregulation. Our thyroid panel and a standard chemistry panel. And if we do find that we have an increased amount of LDL, we need to understand, is this small and dense or is this light and fluffy? Is this going to get lodged in arteries and oxidize and cause us problems? And you may want to run a BAP panel to determine particle size and if that's an issue, and as well as an oxidative stress test to see if these particles that are getting lodged are being oxidized. So what can we do to improve our cardiovascular risk? We can eat to control our blood sugar levels and make sure in that diet that we're including lots of good fat. We want to find and uncover infection, inflammation, get those taken care of. Make sure that our vitamin D levels are adequate so that we can keep inflammation at bay and we can help improve our insulin response. We want to make sure that we're having adequate antioxidant and magnesium in our diets. And if not, take a supplement for those. Consider CoQ10, especially if you're taking a statin drug, and include vitamin E, magnesium, curcumin, proteolytic enzymes to help bring down inflammation. Those would be very important to reduce cardiovascular risk. And if you do have a viral-based infection, things like monolauric acid will be very, very helpful with that. And we can never discount exercise. It is so important for so much in our body. And remember to do things that make you happy. I'd like to thank you for joining us this evening. If you'd like to find out more about functional medicine, clinical nutrition, or genetics, check us out at functionalhealthforyou.com, or you can read our new book, Eliminating the Pain of Elimination Diet. And the book's great because it'll talk in detail about essential fatty acids and cholesterol and blood sugar regulation and good dietary fats, how to utilize those fats in your diet, best ways to cook with those fats, so on and so forth. Basically, the book is a functional medicine approach to diet and health-related issues. Again, thank you so much and have a great evening. Good night.